excited for episode 3. If you've just dialing in, or if you've been following along to episode 1 and 2 with Airway, we are going to tackle, like, we've kind of built the foundation, and now how does this apply to you? How are you going to use this in the conversations that you would have? Is that kind of where we're going with this? Very excited. So welcome back.
Hi, guys.
Yeah, welcome back.
Hey.
Cindy and Julia.
Rather than talking about the medications and jotting them down into the computer, asking, are you taking any new medications? Has anything changed? And circling back to the ones that are there. Maybe we've said, okay, 6 months prior and 6 months prior to that, but let's talk about them today. Julia, you touched on some medications earlier with teenagers, with the elderly. How many of our patients are taking blood pressure medications? Maybe multiple. Maybe a question about, tell me a little bit about your limp. I see you're limping. Well, they're getting a new knee replacement, right? We don't know if we don't ask. And how do we tie this in? Well, you know, once we look in your mouth, it's really important that things are healthy. You're going into surgery. Let's make sure that we do a very thorough assessment today, so they're prepared. We're dripping information about what's to come. And if we, again, I like to always think if we just sort of widen our lens a little bit and say, well, what is a pathology? Is a muscle that's firing on the right side a second before it's firing on the left side? To me, that's a pathology. And if we think about these things, it's outside of normal. It's abnormal, right? And so what do we write on our, we write within normal limits. So once we go into the mouth, the Malampati, are any of you using the Malampati for your work? Go online and download it. You can find it all over. Just type in Malampati and images, and you'll get a great little image of what that looks like.
Like 1 through 4.
Yeah,
right?
And you know, we can even give you one, and you can put it on your site if people want to download it from your whatever works best for you. But those are simple ways to assess the airway. Is it all the way open? Can you see to China, or you're able to see is a big tongue in there? And then talk about that. I won't belabor all of the things that we talked about in terms of physiology and the way that the body's behaving, but being able to recognize the very basic scalloped tongue. Linea alba, wear, abfractions, muscles that are firing unevenly, and then help your patient understand that you want to show them the harm that's being caused as a result. And we talked earlier about night guards and anterior wear. When your patients say to you, I never put my teeth in that position, to say, you know, I bet you never know that you're doing that, and here's why. Show them the airway, show them yours, give them a mirror.
Hypothyroid, for example, is strongly correlated with OSA because both accumulate fluid in the submandibular tissue.
And we're finding that a lot in dentistry, a lot of enlarged thyroids.
Patient, but I can't get past the night guard and how that's where I struggle with the physiology of how that is a sign of my airway issues. But that's also coming from someone that's worn a night guard since I was 16 years old. So like I think that would be my conundrum, is how do I let go of that thing that I've had for a really long time away from me, and I can't make that connection between the airway and that, you know?
Interesting. So it's just a habit, an established habit. Boy, are we talking
and
about
like a
that
comfort, and a level of comfort for me, I think, too.
And so what I would say with Michelle is there was a missed opportunity somewhere along the line because you're tongue-tied. And nobody has explained to you that the bulk of your tongue is tethered in the back of your throat. So some of the other signs that we might look for may not be present in you. But when you're talking, we can see the dysfunction with your tongue. So your brain compensating and creating the wear, and they put a mouth guard in to protect your teeth, and it has, the underlying issue is still there. So it will manifest itself in other ways.
So the next step in the assessment would be we would go to radiographs. The next thing would be taking their checkup films. And if we have a patient who struggles to lean back or gags when we're taking those radiographs, historically, and what we still hear today is